Hello, everyone. Welcome back to the Rise to Your Peak podcast. I'm here with my guest, Allison Fahrenbach, who's obviously been on the podcast before. We had a great episode previously, and she's back for another deep dive. And today we're going to be talking about predominantly insulin resistance and PCOS. So we're focusing primarily on females' health today. That's mainly what Allison specializes in. We may hum a few lines about insulin resistance and how it could affect men too, but we're obviously seeing this be a bigger issue in female metabolic health. So that's going to be our focal point today. Allison, how are you doing?
I'm good. How are you doing, Matt?
I'm doing great. So let's dive right into it. I'm assuming that you probably have your fair share of experience of women dealing with insulin resistance in your practice.
I do. Especially because when we say insulin resistance, I always think it's important to remember that insulin resistance exists on a spectrum. So a lot of times when we say insulin resistance, people's brains automatically jump to like type 2 diabetes.
Yeah.
But if we think of that as being on this end, there's a progression into this end. So I would say that the majority of the women that I coach exists somewhere in this muddy, messy middle, which, as you know, often gets missed by conventional medicine. Was putting things up on my stories this past week even. Because I think the beauty of functional blood chemistry is the ability to catch and identify dysfunction before it becomes disease. So, a lot of times I'll see indicators of insulin resistance coupled with what they're coming to me with symptoms, and a lot of times it's mild.
Sure.
It's not, maybe we're not full-blown pre-diabetic or anything like that, but it's still something worth addressing, because if you can nip it in the bud early, it doesn't ever become
Right.
this big problem.
Right. It's festering, and it may not be that
Yeah.
problematic right now. Give it another 5 years. Now we can't reverse course, or we're in a much bigger hole trying to climb out of at that point.
Right.
And that's
Yeah, and
all the whole
unfortunately,
idea is preventionary care. So we're trying to catch things before it's the problem?
yeah. And it's very common so the majority of the women that I coach are aged 40 to 60. So in that perimenopause, menopausal state. And so that mild low grade insulin resistance is super common. It's so
Sure.
common. And a lot of these women think that the only contributing hormones to their weight struggles are shifts in progesterone and estradiol and testosterone, and it's not. It's also insulin and cortisol
Right.
causing like shifts in body composition and belly fat and all of the things that they complain about.
Totally. Yeah. No, absolutely. And I think it's important too for people to recognize that there's a few different reasons for chronically elevated blood sugar and elevated insulin. One thing that doesn't often get talked about is age-related hormone decline. And so just like we see hormones decline slightly with age, sex hormones decline slightly with age, we see insulin sensitivity decline slightly with age. And now we're even hearing Alzheimer's be considered type 3 diabetes because they're essentially
Yeah.
having too much sugar in the brain, leading to neuroinflammation and those cognitive decline. So we're seeing elevated blood sugar as people age, and we're seeing this as another lever that we need to tweak in this term of anti-aging or preventionary healthcare. So, if you wouldn't mind sharing with our audience, outside of age-related glucose blood sugar dysregulation, what are the other common reasons we may see this happening?
So, as you mentioned as we started the episode, PCOS is also a really common endocrine disorder that sort of walks hand in hand with insulin resistance. I find PCOS to be complex and fascinating because the name is sort of a little bit misleading. I actually really wish they
Totally.
would change, like they would just change the name because you don't have to have cysts in your ovaries to have PCOS. Like, but the name, this polycystic ovarian syndrome, a lot of women think that it's only diagnosed with ultrasound, that you have to have cysts on your ovaries. And the truth is it's a lot more complex and complicated than that. So I find that this is actually very often misdiagnosed and missed entirely, like sort of one or the other.
Yeah.
But I see insulin resistance a lot in women who have hormonal imbalances, menstrual regularities. Those two things typically run hand in hand. Gut issues,
Yep.
the gut is always a player.
Sure.
And then stress. Women who have adrenal issues often also have issues, properly metabolizing blood, like sugar, glucose,
Absolutely.
just properly utilizing glucose.
Yeah.
So, because I also think that sometimes, um, even, and maybe this is my personal opinion, but even just unstable blood sugar to me is also a form of like just riding this blood sugar roller coaster and not being able to properly utilize glucose is also like people think of it as chronically elevated insulin, but I also like to think of it as just you're not able to use it properly. You're just doing this all day long.
Yeah, so even as simply as someone's day-to-day habits, you're dehydrated all day, you're going to have elevated blood sugar, which then transpires to dysregulated insulin sooner or later. You're waiting all day to eat and then binging at night. You're going to have dysregulated blood sugar, you know? A
Yeah.
lot of different things can impact that just from a day-to-day lifestyle component, which is why we oftentimes talk about sleep, hydration, and consistent meal, timing and
I
frequency
know.
as those like just surface level things that can help someone.
Basics.
And
The,
electrolytes obviously in that too. Well, we should say hydration in general, not just water. Um,
yeah,
but
cellular
I
hydration.
I
Yep.
want to go on your point of stress because
Mhm.
again, this is my personal opinion. You may agree. I think honestly, there's too much of a focus directly around food tying to high blood sugar. And we're
Mhm.
always pointing the finger directly at food and the person's dietary choices as the only reason they have high blood sugar, insulin resistance, diabetes.
Not true.
And
Not
it's so
true.
not true. I personally know people on keto and carnivore for a year still with high blood sugar. So I would love a PCP to explain that one to me, other than
Yeah.
saying, oh, they must still be eating carbs. Um, a big,
Stress will spike your blood sugar, like period, hands down. Like if you're stressed or you're having a high cortisol response, I just had this conversation with a client the other week. She's very attached to her CGM, which I don't know how you feel about those. I tend to think in some individuals, they in and of themselves provoke stress because you're
bingo,
so hyper
hyperfocus.
fixated on having to have your number be within this certain range. And that in and of itself causes stress. So
Right.
you're going to get an elevated reading just based on your stress. But I was explaining to her that like she was going through she had been through a really stressful week. And I was like, your blood sugars are probably running a little high simply because you're having a stress response. It's not because she's like, all I did was eat salmon and cauliflower. I said, it's probably not just the food, girl.
Right.
Like the stress does play a role. Stress plays a role in everything. Stress
Yeah,
response, nervous system regulation, the
exactly.
health of your adrenals,
Exactly.
what your cortisol is, when, is it high when it should be high? Is it low when it should be low? Is it
Right.
high when it shouldn't be high? Is it low when it shouldn't be low?
Right.
Cortisol dysregulation is almost this whole other
What I like to
topic.
do to help people understand, because, when we say stress, people kind of, to a degree, kind of shrug that off or roll their eyes of like, well, of course I'm stressed. That can't be the only answer or anything. But I think it's always important to educate people in somewhat of a layman's explanation of why. Why is stress the culprit? And so what people need to understand is that first and foremost, the human body is way smarter than us. So whatever your emotions are telling you versus what your body's telling you, chances are your body's right and your emotions are wrong. The body is always adapting to survive or adapting to the stimulus it's given. So high blood sugar, when we say it can be stress related or a stress response, let's take that a step further. It's a survival adaptation. If you're being hunted by a lion, your body is going to raise its own blood sugar as a fuel source to fight or flee a situation. What that means in even deeper terms is it's going to take glucose, pull it out of the cells, and keep it in the bloodstream so that you have active fuel.
Energy. Yep.
Notice how we didn't say anything about eating food. We're talking about energy preservation for survival. And guess what? In modern day humans, we have chronic stress. So now it's not just being attacked by a tiger, it's being attacked by a tiger every minute, every hour, every day of every week for every month. So the blood sugar never has a chance to go down. It's chronically elevated because the stress, or better yet, the fight or flight response is still there. The
Yeah.
insulin has to compensate. And so that continues to elevate in compensation with the fight or flight response. If you were about to slam into a car in front of you, that would be a good thing to get that energy, and survive. But because it's chronic, we're looking at it as this negative symptom affecting our day-to-day lives. It's a survival mechanism, though. The body is trying to help you survive. So, unfortunately, the answer is you need to reduce your stress. Now, is that just external life stress or mental stress? Maybe, depends on the person. Could it be internal burdens that you didn't even know about? That's what we're seeing a lot of. People don't even know what to fix in terms of fixing their stress. I think that's the biggest cause of the chronic disease epidemic.
Yeah, I think especially with women, they're so used to existing in a stress state that if you try to have a conversation with them about stress burden or nervous system regulation, they say, I'm not stressed. And they genuinely believe that what they're saying is true. But I always try to emphasize to the women that I coach that there's a difference between your mental perception of being stressed and your body's physiological adaptation in response to stress. So even if you don't think that you're stressed because you're so used to just existing in this state of fight or flight, your body is still making adaptations and it is still responding and it is still doing automatic things without your conscious effort to keep you alive.
Bingo.
And so I think a lot of it has to do with the fact that people in today's society, particularly obviously women, because that's just, I typically coach women, they genuinely don't think they're stressed. They think everything is just normal and par for the course. And when I talk about, you know, healing with my clients or health or even changing body composition, right? Whatever your goal is, I always talk about like a hierarchy. And I always talk about, because women in the age demographic that I coach, they always want to focus on the hormones and the hormone symptoms and why are the hormones awry. And I'm like, by the time the hormones have went wrong, about 10 other things have happened. And at the base of that is stress and nervous system regulation and your body's physiological inability or struggle to get into parasympathetic nervous system function. Like you genuinely just are constantly sympathetic dominant.
Yeah.
You're running like you're just all the time stressed.
Yeah.
And until we fix this, you can piss and moan about the hormones all you want, but it's kind of like you're trying to fix this piece without this base of a foundation. It's like trying to hang, I don't know, trying to put a roof on a house before you've laid the foundation. Like you're operating like ass backwards.
Right. Yeah, no, totally. And, something I always try to put in perspective for people is, maybe you don't have a lot of perceived stress. And like you said, perceived perception. So maybe they're just not in tune with themselves, or maybe they don't have that perceived stress. But your body's perception of stress and our perception of stress is different. So we're
different.
not just talking finances. We're not just talking work and family. We're talking inflammation. We're talking infections. We're talking toxic burden. And we're talking trauma. We're talking thinking patterns. We're talking overtraining, under eating, under sleeping. We're talking about the full equation because your body's been keeping score since day one. You
I
know,
love that you mentioned thought patterns too, Matt, because, you know, so many women are so negative
yeah.
towards themselves. And Victoria Felker has talked about this before, but literally you can lose your cycle just from negative body image, from negative thought patterns. Like, I think it's so important for women to realize that, and I hate to draw like gender distinctions, but like our bodies are less stress resilient than men's. We are more stress responsive. Like our bodies make more adaptations in the face of stress than men simply because our bodies are more protective because we were designed to reproduce, like we were designed to carry life. So,
Procreation is the female role.
yeah. So, stress on our physiology can be as simple as I look at myself in the mirror every single day and I say negative things about myself. I think negative thoughts. It can be as simple as I don't get good sleep.
Right.
It could be as simple as I don't eat really well.
Yeah.
I maybe ate once or twice today and it was crappy food.
Yes.
Like it could be as, like, it can be these very simple things. It's
Yeah.
not just, do I have a stressful job? Do I have a stressful personal life? Like, am I caring for an aging parent? Like, sure, it can be those things, but it can also be, I'm wandering around with, I don't know, low stomach acid and H. pylori, and I don't really know it. It can be these very simple things. I don't poop every single day normally. I have like, I'm recycling old estrogen. It can be so many things that I think
Accumulating.
people don't even think of.
Yeah. And they're all accumulating. Something I always try to help people understand too is that it's more so that we have a stress bucket more than
Yes.
individual stressors. Obviously, I'm sure you've had this client where they're like, oh yeah, last year was so stressful. I went through that divorce. Okay.
Hmm.
Yeah, that divorce was stressful, but let's also think that so now you're a single mother with two kids, you decide to pick up a second job. And for some reason, you also decide to do your first bodybuilding competition all in the same timeline. So,
Yeah.
was it just the divorce, or was it that culmination of things happening at once, some of which
Yeah.
were poor choices, poor time management, and that snowballed into dysfunction? And I think people
Yeah.
need to better understand that something that may have happened 20 years ago, your body's still keeping score of that and things are accumulating over time.
Yeah.
That's also why healing isn't overnight because we're
No.
reducing those accumulations, retraining the nervous system, retraining the immune system. All those things have to happen to get someone back to, for lack of a better word, normalcy, homeostasis.
And that's a roadblock to healing too. So like if I have somebody who's come to me and they're like, so I have, and let's say they have a gut issue and they've done like, 3 or 4 protocols and they haven't responded. I'm always like, have we taken a look at the stress? Have we taken a look at the trauma? Like I have seen this be a roadblock to somebody's ability to clear an infection, respond to a protocol, receive and respond to hormone therapy, lose weight, like all of these things, because again, I just come back to that base of that pyramid isn't ironed out. And it's such a hard sell. I don't know if you find it to be a hard sell to clients,
Yeah.
but it's such a hard conversation to have because they're fixated on the end result. And I'm trying to say, look, I know it sucks, but you got to start all the way back here. And we have to layer this in. Like, I know it's hard and this
Yeah.
isn't instantaneous. We like that instant down. We're like this instant download society, but sometimes it takes much more time than that.
It does. Yeah, it absolutely does. We didn't get into a place of dysfunction overnight. We're not going to get out of it
No.
overnight. Something that typically helps me, through the clinic, as the medical forms ask a good bit of details about symptoms. So
Yeah.
as I'm having that conversation, trying to explain stress adaptations, and I'm looking at symptoms, we typically see some common symptoms, especially from the female world. Trouble sleeping, anxiety, mood instability, low sex drive, irregular periods, maybe some depression, maybe some other symptoms, high blood pressure and stuff like that. So I'll zoom out that lens because we're so fixated on our modern day life. I'll
Mhm.
say, let's say you're stranded in the jungle being hunted by a wild animal. That would be pretty stressful. And while being hunted, you're probably not sleeping too well, are you? And you're probably anxious all the time, aren't you? And they'd be like,
Yeah.
well, yeah. And then I'd say, and after multiple days of being hunted and not getting good sleep, now you probably have a lot of irritability and mood instability, don't you? Yeah. And at no time while you're being hunted are you thinking about sex, are you? No. We just described all of your symptoms. These are all stress responses. And
Yeah.
I think women also need to get a better understanding overall around how their bodies actually work. And I know that sounds like a crazy statement to make, but you agree
No,
they'd be
I
surprised.
I just had this conversation with a friend of mine the other day. We were just venting about it because I mean, I told a woman to have her labs drawn in her luteal phase and she didn't know what her luteal phase was. Like, and I don't mean that
Trash
to make
women.
fun of her or
Yeah, yeah,
anything like that or to judge her.
yeah.
I'm saying women in general are just not educated about their bodies,
No,
about their cycles,
no.
about their hormones. I mean, I can remember, I think you're about the same age as me. I don't know how old you are, but I'm 41. And I remember like being pulled into, the school nurse with the other girls in my class, and I was given like a pad and a tampon and told like I was going to get my period, and that, nobody ever told me why I needed progesterone and estradiol beyond just making a baby.
Ability.
Like nobody educated me on the importance of ovulation or the way that my cycle reflected health and was an indicator of how, like, women just in general are not taught about
And yeah,
their
I want to be clear that it's not women's fault. It's
no.
our healthcare system and
Yeah.
society's fault. Because how
Yeah.
many doctors have you met that say, oh, you only need progesterone to get pregnant. Don't worry about that hormone.
It happened to me. It completely happened to me. Like when I lost my cycle for a very long period when I was competing,
Mhm.
and I couldn't get it to come back. And I remember having a conversation with my PCP at the time, and he said, "Are you concerned about, your fertility? Are you concerned about having a baby?" And I said, "No." He said, "Then it's really not a big deal if you don't have your period." And I'm like, that it kind of seems like it's something I should have. Like,
As a woman.
I mean, I was very young at the time. I was in like my mid 20s, but I was like, that just doesn't sit. And I think it's so unfortunate because it literally is like saying, do men only need testosterone to make a baby? I mean, if you said that to most people, they would be like, no, men really need testosterone. And you would say, okay, so if we then, or let's, use the birth control analogy, if we put men on a pill that suppress their testosterone for the majority, like, do you think they would maybe feel crappy? Yes. Okay. So if we extrapolate that into women and we say, so women aren't getting a period or they're not making progesterone and they're not producing estradiol, do you think then maybe she might not feel so great? It's like, this is logic to me.
Which, by the way, the only reason there's not a male contraceptive is because they all do that. And as a society, we refuse to crash men's testosterone and make them feel unhealthy. So let's just think about that real quick.
Yeah. Yeah.
Don't even get me on that soapbox.
Yeah.
But yeah, I mean, I think what women need to understand is that just because of their physiological design, they are more dependent on adrenal health than men.
Yes. We
And
make
that
hormones
doesn't
from
mean
our
that they're
adrenals.
weaker. That doesn't mean that they're softer than men. That doesn't mean that they are incapable compared to
It's
men.
just different. It's
It's just
just different.
different. I think women are actually mentally tougher than men across the board. In competition terms, I liked training females way better than men because they were fucking balls to the walls and had, total pain resiliency.
We have a
Pregnancy,
higher
they
pain
higher
tolerance
higher pain tolerance because it's
because we're built to reproduce.
yeah.
Like we have, yeah. And I think trying to compare the genders is just a mistake. I think it's
True.
just best to understand the differences and be
Respect the
honoring
difference.
of those differences. Like,
Yeah.
but I tell women all the time when I talk about sleep and how important sleep is, I'm like, you do know that you make up to 30% of your hormone from your adrenals. Like, you need to be getting sleep because
Yeah.
what goes off when you don't get sleep is your adrenal glands. Like, I'm so glad that you mentioned um the adrenals and
Well, and
sleep.
I think that it's not a conversation I often have with women who are especially like high performers and stuff like that is like,
Mhm.
I'm not saying that you can't do what men do, whether it's a CEO, whether it's an athlete. I'm not saying you can't do those things. I'm saying you probably need to take a slightly different approach than a man because 5 hours of sleep, a couple energy drinks a day, not eating, and then going to a spin class is
Mhm.
not going to work.
No. And that type of woman that you're talking about is literally my client avatar. Like those are
Yeah,
literally the women I work and I can relate to them because I'm very type A myself. What I
sure.
always say is it's not going to serve you, especially as you get older. It's just not. Like there's a lot we can get away with in our 20s as females. And then as you start to enter your 30s and 40s, you start to pay the piper for that type of stuff.
Yeah.
And I think that exact type of woman that you discussed is the exact type of woman that falls prey to
Yeah.
insulin resistance and hormonal irregularities and imbalances and things like that.
Yeah, totally agree. Let's slide over to getting a little bit more into the PCOS conversation because you brought up some great points earlier that I wholeheartedly agree with. One thing that I'll preface this with, in my opinion, is I think Western medicine as a whole and our society as a whole is too focused on labeling things. You
Yeah.
know, I think that PCOS is a blanket label for a slew of different symptoms, and that keeps getting broader, of
It's
like
like IBS.
ex-
It's like
exactly.
like I always say PCOS is like the endocrine version of IBS. So like if you look at what PCOS is technically called, it's androgen excess without another cause. So you've got this woman who has androgen excess, and let's say that the doctor has ruled out other things, like all of the other potential possibilities that it could be. They'll go, oh, okay, it's PCOS. Well, it's the same with irritable bowel syndrome.
Sure.
It's taking a symptom and making it a diagnosis, right? I have this client who's got constipation or diarrhea. Don't really know what it's from. We've run all these tests and we've ruled out everything else. So, okay, you have IBS.
Right.
So it's like this umbrella term for this it's basically taking a symptom and making it into a disease.
Exactly.
And
Exactly.
I feel like that's unfortunate for women because one, it makes them feel like there's nothing they can do.
Yeah.
It's just this thing that they have and they
Well,
don't
and some
understand
women
it
adopt that label and create a personality around it
all around it. Yeah.
and brand themselves with endo belly and endometriosis and PCOS and this
Yeah.
and that. Now they have a TikTok with 200,000 followers. And you try to speak to them and say, hey, some of this is reversible, right? And they get
Hmm.
angry. They're like, it's not reversible. This is my whole being and stuff. And it's just like, oh, okay.
Some of it's reversible and some of it, I would even argue almost all of it is very manageable.
Yeah,
And it's really just about working with somebody who's going to help you figure out why
right.
versus just telling you what's going on.
Bingo.
Like, with PCOS, like I said at the beginning, it is a very complex disorder. Like it's very
Yeah.
multifaceted. So this isn't really like we're gonna go look for one thing that's wrong. It's usually a couple of things and like they're intersecting.
Mm.
But there's insulin resistant PCOS, there's inflammatory PCOS, there's adrenal PCOS, you can have post pill PCOS. So like there's lots of causes. Like
Sure.
when modern medicine or when conventional medicine says it's androgen excess with no known cause, that's sort of a little misleading. I feel like it's androgen excess and there is some underlying factors at play here. You're just not willing to dig with them.
Or
And
they're
it's the
just not
same with
educated.
it's what was this?
They're just not educated. They don't
That's true
know
too.
that women's androgens come from the adrenal gland.
Like, it's just not a tool in their toolkit.
Yeah,
Like, you know, same with IBS, like I mentioned. It's like there are actually a lot of root causes of IBS.
correct.
It's just they're not going to go through that with you. Like they're not going to investigate SIBO. They don't even honor a GI map in conventional medicine. I've had clients take GI maps to gastroenterologists and they're like, what the hell is
Yeah,
this?
fake
So
science.
it's just not, yeah, it's not validated. It's not this, it's not that. So, you know, I think
I think
again, I just
what might be helpful is to break down, the common occurrences we see with the PCOS diagnosis, and then go into detail of why each of those things may transpire. And in my experience, they all have a very similar cause, stress.
yeah.
So ovarian cysts. In general, ovarian cysts present themselves due to imbalances of estrogen and progesterone and irregular cycles.
And right
What's most
there,
likely that cause?
right there, I even have a problem with the Rotterdam criteria for this because so cysts are very common in women, period. Like regardless as to what, like regardless of age, regardless, like it's not uncommon to have cysts.
Sure.
And so you have this woman who goes and maybe they find some cysts and her cycles are also like I see a lot of women with hypothalamic and amenorrhea misdiagnosed with PCOS.
Exactly.
And this is a huge problem
Right.
because she's going to go back and try to eat less or eat keto or do something else. And really, that's a woman who needs to eat more and get her cycle to come back because she
Right.
needs to alleviate the stress of under eating or something like that, or she needs to address the fact that she's lost her period.
Right.
So I even have a problem with the diagnostic criteria for PCOS because I feel like it just steers women in like the entirely wrong direction.
Well, I mean, I think it steers them in a surface level. The amenorrhea
That's
is
a good way to
happening
verbalize it.
because of low progesterone, which is happening because of high cortisol, or birth control, or something that elicited low progesterone in the first place. So
Yeah.
typically, ovarian cysts are going to be related to progesterone imbalances, which is related to most likely cortisol or birth control. Okay, check that one off. Insulin resistance could be lifestyle and dietary related, but as we talked about, very much stress related.
Yeah.
Androgen dominance, knowing most of the androgens in a woman's body come from the adrenal gland, safe to
Stress.
say that's a stress response. So, all three symptoms, all tracing back to stress.
Yeah.
So, that's the core. Instead of the PCOS label, we need to say
Mm.
you're too stressed and your body's having several different adaptations simultaneously, all coming from the same place. Most
That's
likely GI dysfunction,
I
most
was just going to
likely
say
some
the
other
gut.
issues,
I was just going to say the gut. Yeah, like I always think of PCOS as just chronic low grade inflammation and
Yeah,
all of the downstream side effects from that. So, and whenever we talk about inflammation, or at least when I talk about inflammation, my brain automatically goes to the seat of inflammation in the body, which is the gut. I'm always thinking about the gut when I have somebody with just like chronic low grade inflammation. And it's the same with women who have PCOS. I find a lot of women with PCOS have gut problems, imbalances, dysbiosis,
absolutely.
unaddressed SIBO, H. pylori, like low stomach acid, like something is going
Absolutely.
on in there. And if addressed, can make a world of difference in how they look and how they feel, symptom management,
Yeah,
things like that.
absolutely. And then it becomes a question of, was the gut the initial stressor, or is the gut just another adaptation from stress similar to the hormone imbalances? And then you find out about the trauma, the mold
Yeah.
toxicity from 15 years ago, the
Yeah.
Lyme disease that they've had their entire lives, all those other internal burdens that go even deeper?
Yeah. Yep. 1000. And even non internal burdens like the
Yeah,
unhappy marriage they're stuck in.
exactly. The, the
The,
the things that can be present in our day to day.
yeah, 1000%. I
Yeah.
agree.
Yeah, and I think that it's just a lack of understanding around like symptoms versus root cause and getting to the bottom of that root cause. Now, is that to say that every single case of PCOS is 1000% reversible? No. What we're saying is
No.
a lot of PCOS is a misdiagnosis or improper diagnosis, and there's
Yeah.
further steps to take, further diagnostic testing to do. And I think a bigger issue in our medical system is the silos we work in. We see
Oh
one
gosh,
specialist
yes.
for our heart, one specialist for our mental
Mhm.
health, one specialist for our hormones. The list goes on. Whereas you and I can zoom out that lens and say, this is
Yeah.
all integrated in one or
Yeah.
two issues, you know?
Yeah. And I think the another issue that just like popped up in my mind as you were talking is when you said, it's misdiagnosed or then it's missed, is like a lot of times women with PCOS, they go to their OBGYN or they go to their gynecologist and they say they're having issues and they say their menstruation is irregular and their solution is take the pill. That's the solution. So, which inevitably makes things 10 times worse. And then you have a condition that was never addressed. Like you have a condition in which you could potentially manage it or somewhat reverse it. Maybe just mitigate symptoms. Like I always hate to use the term reverse, but like you can really make dramatic improvements in the
Yeah.
majority, I think, of PCOS cases. I would argue if you do the right things.
Yeah.
And you could catch it, you catch it early when she's young or something like that, and it's totally manageable. But instead, they just pop them on the pill. It'll regulate your cycle and you'll be totally fine.
Right.
And it's just missed. It's
Yep.
just completely missed.
Yep.
And I find that to be just irritating and unfortunate.
It's extremely unfortunate. And, for our viewers to try to have a better understanding of why that may be, um, lack of physician knowledge is a potential reason, not always the reason, but potential. Um, Thinking that kind of birth control is like the one pill fits all solution for women is also way too wildly practiced in our medical system. It's just like acne, anxiety, anything you complain about, here you go. And I think that that's somewhat related to the incentivization of big pharma and insurance companies to those physicians. I think the
Yeah.
physicians are incentivized to push those products, whether that's financially or otherwise. And I think there's also a layer of fear from liability of like, if a practitioner doesn't provide you any solution, that also is not great. So
Right.
sometimes they're left to limited options and that's their only option. But it's unfortunate that that's their only educated option for women. Like that's not good.
No. No, and I feel like birth control is not mm, it's an option. It's like the only option they offer, and it's an option that's offered without any education behind it, without any information given, without any explanation of potential side effects or potential long-term side effects, or, hey, when birth control actually came out, it was not something that was intended for long-term use, and you have women who just take it for like decades. Like I have women who've been on birth control since the age of 16 and they're coming to me at the age of 50
Yep.
and they've been on it the entire time
Yep.
and they have no idea if they're menopause. How would they know?
Yeah.
Right? Like, how would you know? So I think like that's my biggest gripe with it. It's like, okay, it is an option, it's out there, but like you need to present it in addition to other options, right? Patients should have a buffet of options
True.
and it should come with education around it. This
Bingo.
is what it does. This is how it impacts you. It will shut down ovulation. A pill bleed is not a menstrual cycle. Like, all of these things so that women then have the education and the informed consent to figure out what's best for them. But it's not. It's just, well, you could take the pill.
I think you just nailed something that not enough women are actually recognizing is so problematic. There's always this talk about, women's freedom of choice and women's health. How about educated choice? How
That's
about
not freedom of choice.
exactly if you're
One
being
choice is not
misled?
freedom of choice. One choice is like it's almost like it's forced. And if you think about, I always think back to, where I was at when I was 14, 15, 16. If I had went to the doctor at a young age with menstrual irregularities and been told take birth control, I would have done it without asking questions, because a lot of times people come back and say, well, women need to ask questions. And I'm like, really, you want like young girls to be advocating for themselves in a doctor's office? Like, I just don't know that that's appropriate. Like, I don't think, I
How do
don't
they
think
know what
women,
questions to ask?
I was just going to say, I don't even think enough women know what questions to ask. And I think there is a measure of trust that we have as a society in healthcare. We assume that when we go to see the doctor, we are being presented with the best information, the accurate information, and this person is telling us what's best for us.
Yeah.
And if that's only one option, then we assume that's the only option we have.
Yeah. Well, and that's
So I,
I definitely think that trust has declined in the last 5 years. Um,
mm,
but 100% agree with you. And yeah, like we just said, how does a young girl know what questions to ask? But furthermore, how does she know that the answers provided are right or wrong? If it's coming
right,
from a person with a $500,000 degree, you would
right.
assume they're going to tell you correct information. So why
Yeah,
even ask? Like, how
yeah.
is a 14-year-old supposed to know like the details of adrenal compensation and the metabolic
Mhm.
pathways of hormones and stuff like that? Why
Yeah,
their progesterone may be slightly imbalanced? They're not going to know any of that.
no. No, I agree. And I think you really hit it too, Matt, when you said like, it's not freedom of choice. Like freedom of choice is having multiple choices and being educated and informed. Freedom of choice is not just this one option. And
Right.
I always try to, I am I have trended a little bit more anti-birth control only because I know of the impacts that it has on female physiology. But I always try to say I'm not anti birth control in the sense that I don't want it out there or I don't want it available. I just want women to understand and be aware and be
Absolutely.
informed. And because I do see a lot of negative downstream effects from it, including insulin resistance is one of them, including gut issues and thyroid issues
Nutrient
and
deficiency.
nutrient deficiencies and, mood disorders. Like, I don't really think it's a coincidence that the majority of women who are on some form of birth control are also on some form of SSRI.
It's like
Like,
a 2-for-1 package.
right. Like now they get you for two medications instead of just one.
Exactly.
So I just don't see that as a coincidence. And I've supported a lot of women in coming off of birth control over the years. And I can safely say that I have never had one woman come off birth control and not been so very glad that she did so
100%.
and not
And
felt
also,
much
too,
better.
I'd say that there's probably, this is going to be a broad statement, but there's probably a time and place for every single medication that's out there.
Absolutely.
The problem isn't specific medications, whether that be control, statins, whatever. The problem is the abuse and misuse of these medications.
Misapplication. Yeah. Misapplication.
If your only goal as a 16-year-old is to not get pregnant, you should probably use birth control if you're going to be sexually active. But the regulation of cycles, the balancing of hormones, the acne, the other things, that is not a solution.
Yeah. See, and I like that you brought up the regulation of cycles because that to me is a lie.
Hmm,
When
agreed.
when when conventional doctors say this will regulate your cycle, to me that is a lie. And
Yeah,
I don't believe that as a doctor they don't know that birth control doesn't regulate your cycle, it shuts down your cycle.
right.
Like, so just be honest. Like this is not going to fix the glitch in the system. This is going to turn the system off.
Boom. Yep.
So I feel like to me, that's just an outright bold-faced, like, that's a lie.
Wholeheartedly agree.
That's one of the biggest pet peeves that I have about that is the cycle regulation. No, I'm so sorry. Like,
Yeah,
it's not
and if
regulating
we're
anything.
mincing words, maybe maybe the argument is, well, they're having a bleed the same day of every month, but they're not ovulating. That's the
Yeah.
whole point of the birth control. So they don't have a full menstrual cycle. They're having symptoms of a menstrual cycle, which is a bleed.
And ovulation is the main event. My gosh, it's like the best. It's the best one. It's the way by which we make hormones.
Yeah,
Like that's how we make our hormones. If we don't ovulate, it didn't happen. Like,
yeah.
and that's exactly the reason why hormones decline as we age, because we have more anovulatory cycles. We start to produce less progesterone in early perimenopause, and then eventually that progresses into less estrogen, and so we just ride this roller coaster down. But, you know, I have such love and respect for ovulation because it literally is the way by which we produce hormones. And I think the majority of women struggle from low progesterone more than anything else, not low estradiol, not even low testosterone, but just like low progesterone.
I would say this is anecdotal and don't quote me on the accuracy of this number, but in my opinion, 85% of American female society is estrogen dominant.
Yeah. And it's so important, when I talk to women about that too, it's so important and for your listeners to understand that that term estrogen dominant doesn't just mean high estrogen
Right.
or high estradiol. I should be more specific because we actually make three forms of estrogen, which I explain to women too, estrone, estriol, and estradiol. But it means your where your estradiol is relative to your progesterone. So
Right.
you could have normal estradiol, but if your progesterone is bottomed out, you're still running estrogen dominant because female physiology really loves homeostasis and balance. And
Harmony.
it's the same with testosterone.
Right.
You could have normal levels of testosterone, but if you've got bottomed out progesterone or super low estradiol, you're running androgen dominant.
Yeah.
So it's not just about, I always talk about hormones in relation to one another versus
Yeah.
just treating them as if they're in silos, which is a lot of times what women think, even when they take hormone therapy, they're like, well, my testosterone is low, so I took testosterone. And I'm like, right, but that's going to affect everything else too.
Uh-huh.
Because hormones don't operate in isolation. They work in cohorts with each other.
I think that thinking pattern honestly comes mostly because our education is more directed towards men's healthcare than women's healthcare, and we're not
Mm,
differentiating the physiological differences there. So I think
mm,
that's a lack in our medical education system of separating the intricate differences in a woman's body versus a man's. But to that point, I even tell men there's still a testosterone to estrogen ratio that we like to
yeah.
see.
You
Uh,
still need estradiol as a man.
Right. So I'm typically going off of like a 30-to-1 ratio, 1200 test, 40 estrogen. We're wanting that balance still. So in both men
Yeah.
and women, it's harmony, it's balanced ratios. But in a woman's body, because there's more hormones, there's more details to that balancing
There's
act.
more players in the game.
Yeah,
Yeah.
there's more juggling happening there.
Mm-hmm. 1,000, like 1,000%. And I agree with you on a lot of people running estrogen dominant. I just think that it comes not from too much estradiol, but
Not
from
progesterone.
too little progesterone.
Yeah, birth control
Um,
and stress. That's the
yes.
culprits to 85% of women's issues. Those two
Yeah.
things.
Yeah, I had a client the other day. She's been having some menstrual irregularities and her progesterone is super low and she's not on birth control. And I said, it's your stress.
Yeah.
It is your stress. Like if a woman at your age, she's 28, I was like not ovulating and producing like a point 0.6 progesterone,
Wow.
you're under stress. I'm not stressed. Your body says otherwise, sweetheart. And I feel like there's just not enough education in women around, you know, if your body is just trying to survive, which is what fight or flight mode is, it doesn't give a rat's hoot about reproduction.
Bingo.
It's not sitting there going, this is a great time to make a baby.
Right.
I should have a baby right now.
Yeah.
It's going, we need resources diverted to other things. I talk about that too with women who have chronic gut issues or they're bloated or there's undigested food in their stool, and I'm talking to them about stress. And I'm like, you have to understand that when your body is stressed, blood goes into the extremities, right? Fight or flight, or what is it? Rest and digest, meaning your body can digest or stress, not both. So
Right.
you're diverting blood away from the stomach. You're just diverting effort and energy because the body's like bracing itself.
Yes.
It doesn't give a rat's ass about digesting your food. It just doesn't care.
Yeah.
It's not a priority. And its reproduction is not a priority when you're stressed. So you're going to see the effects of living a high stress life or placing your body in a position where it's high stress manifest in your hormones.
Which, by the way, same goes for muscle growth and fat loss.
Yes. Yeah.
Your
I
body's
talk
not
about that.
going to do that if it's stressed either.
No.
That the episode we talked about with Dr. Kinney, she uses a great analogy of kind of talking about your body as a house and your
Mm-hmm.
nervous system and immune system being the security system, and
Mm-hmm.
your fat loss goals being the hoarded old clothes in your closet that you never get rid of. If
Mm-hmm.
someone's breaking through the front door and the back door, you're not worried about your cleaning out your closet. So your
Yep.
body has to prioritize things. And if your nervous system is too focused on survival, we ain't cleaning out that closet of stored fat, you know? So it's
Yeah.
all about priorities of the body. And if we can find that balance of nervous system regulation and immune system regulation and fueling ourselves and providing the proper activity, all those things work together to
Yes.
allow you reach your goals. But like you kind of mentioned earlier, we're in an instant result type of environment. And for a lot of people to even consider, well, first I have to dedicate 6 to 12 weeks to reducing my stress before I can even focus on fat loss. They don't even want to, consider that. But it's like, okay, well, the time is going to go by either way. So in 12 weeks, you're going to be in the same body. You could either have less
Yeah.
stress and be in a better place to make progress, or you can be in the same exact place that you're in right now.
I always say, like, I had a very difficult conversation with a client a couple of months ago, and she was just like, "Well, I don't have that much time to wait to lose this fat." She really wanted to do like a quick fix, and I'm like, "You've spent the last 15 years doing quick fixes, not losing it properly. You're
Boom.
telling me you have 15 years to piss around on quick fixes that don't work, or you could take 1 year and do it right." And get it right. And you know what I mean? Like, you do have the time. I know it's not an easy sell because we do live in a society with a very short attention span and very much an Amazon Prime, get me the overnight delivery, the instant download, the website isn't loading fast enough, I'm going to X out of it type of society. But the body, I always say the body is a crock pot. It's not a microwave. It's not going to do these instantaneous responses. So it doesn't really matter if your goal is losing weight or your goal is balancing your hormones or your goal is healing your gut. There is a patience component to it because it's about positioning your body properly and then giving it time to do what it needs to do.
Absolutely.
And you can't rush that. You just can't.
No, no, absolutely. I love that. Well, and the thing is too, I don't know how much you experience this with your clients. I'm assuming you experience it a lot, but when we have a female patient come to us, dysregulated hormones, very inflamed, insulin resistant, metabolic adaptation, even in the process of healing, their body is improving. We see
Yes.
women lose 20 pounds simply by fixing their
Yes.
gut and fixing their hormones. So it's like, although maybe that
Yes.
wasn't our goal, we weren't doing spin
Mhm.
classes 7 days a week. You saw the progress because a side effect of having a healthy body is
Is a
healthy
healthy body
metabolism.
weight.
Yeah.
Yeah, and it's a
Yeah.
healthy body weight. Yep. The body will naturally respond when you give it the tools and resources that it needs. It's so often, Matt, I help women do less, not more,
Exactly.
because
Almost all the time.
most of the time they come to me already doing too much or
Exactly.
trying to do too much.
Exactly.
And in doing too much, they're adding that stress bucket you talked about. It's just overflowing. So what happens when you start to pull drops out of that bucket is you start to get a physiology that's like, oh, okay, I can lose weight. And it could just take a breath and that weight can just sort of come off. And I always call that just like, inflammatory weight. You're just literally reducing inflammation in the body and you're giving it permission to respond to what you're doing.
Yep.
I've heard the analogy before. This isn't my own, but she said it's like somebody's calling you, but you're at home and there's a pot on the stove that's boiling over and your kids are screaming and you really would like to answer the phone, but you're like, I got to deal with all this stuff first.
Yeah.
She's like, the phone is the weight loss. And all this
Yeah.
other stuff is the stuff that your body's like, I would really like to lose weight, but I have to deal with this shit first.
Okay.
And until it does, it's like a mute point. I always say, that whole calories, hormones fight that the social media likes to jump into. I always say, like, of course, the laws of thermodynamics exist and nobody's escaping them. But the laws of thermodynamics assume a balanced hormonal environment.
Bingo.
And so if this environment is unbalanced, calories in, calories out is a mute point. We have to fix this first so that you can respond to the deficit. So much of what I do is help women get healthy first so that when they decide to do a deficit or a cut, they're not fighting an uphill battle.
Right.
Their body's working with them instead of fighting against them. And 9 times out of 10, I don't really have to do a cut because in getting them healthy, the body just dropped the body weight anyway. And they're like, I feel really good and I look good, so I'm fine.
Yeah, exactly. Exactly.
Mm-hmm. Yeah.
Nailed it. Well, I know we both have busy schedules. Are there any finishing thoughts we have for our viewers in terms of, let's say they're maybe concerned that they might be insulin resistant, or maybe they've been told that they have PCOS, but they're looking for a second opinion. What would, in your opinion, be, first steps?
So I think first steps would be to get with somebody like you or somebody like me or somebody who's going to have a more holistic perspective towards health and towards the body.
Yeah.
And somebody who's going to help you dig a little bit because you are going to have to dig. I would say somebody who's going to, look at your labs with a different lens, that functional blood chemistry lens I talked about earlier. If your blood glucose is a 95 or 100, your conventional doctor is going to say you're fine. And I'm going to say we're trending in a bad direction. If your insulin fasting is a 10, your conventional doctor is going to say thumbs up. And I'm going to say we might have a problem. If your A1C is a 5.6, your doctor is going to go, you're good to go. And I'm going to say not quite so much. So I think sometimes just obviously getting labs and obviously having that information available, but potentially just working with somebody, doing a consultation, doing one-on-one coaching, who just has a more holistic view of the body is going to be somebody who's going to help you dig just a little deeper and get some more answers and give you some options so that you can make the best choices for your health.
Absolutely. And to add another layer to that regarding the diagnostic testing, the more comprehensive of a test you get, the more this specialist that Allison was describing can give you real answers as to why, real cause and effect, as well as a intelligent plan for remediation. But if you only come with us with HA1C, there's a lot of hypotheticals that could be wrong. So if you haven't already gotten blood work, maybe connect with the specialist first and ask them what labs they like to see. Because if you're coming to me with blood sugar issues, I'm automatically going to ask for a cortisol reading too.
Yeah. Mm-hmm. Yep. And I always look at liver values because there's like a definite liver component to insulin resistance too. Sometimes it can be a little bit sneaky, non-alcoholic fatty liver disease. So yeah, that's a really good point too, Matt. Like, finding somebody that you think you want to work with and asking them what they need to help you make the best,
Don't be shy to invest a little bit more in comprehensive labs because that little bit added investment could be the whole answer which then creates a real solution. Limited labs never helps. Now, don't get me wrong, sometimes there's unnecessary lab markers, but
Mm,
that's something you can talk about with that professional, and they should be able to explain why they want specific markers. If they can't explain why, big red flag, move on.
agreed. 1000% agreed.
All right, Allison. Well, thank you so much for your time today. I think this was a great conversation. I think it's going to open up a lot of reflection for our viewers who may possibly be in some of these boats. Um, you've been on the podcast before, so people should know how to get a hold of you. But just in case they're new viewers, why don't we help them out with how they can connect with you, email, socials,
Yeah.
website, etc.
Yeah, so I am at Allison Fahrenbach, just all one word, ALLISONFAHRENBACH on Instagram, and I am fairly active on Instagram. My website is just revivewellness.health. That's my company, Revive Wellness Health and Physique. And anybody's always welcome to reach out to me. And, thank you so much for having me. It's always so good to have more conversations with other FDNPs, other
I love it.
functional, like-minded individuals. So I truly appreciate it.
Absolutely. Thank you for your time today. We'll be chatting again soon. I look forward to the next episode.